Hello, my name is Megan Haggerty, and today I am going to be discussing the healthcare system in Spain. I will be highlighting how it came about, what it entails, and some challenges it faces today. However, those challenges do not include the current world event of coronavirus. So let's get started. The Spanish healthcare system is known in Spain as the Instituto Nacional de la Salud. It was founded on Spain's General Healthcare Act of 1986. Basically, this act said that the Spanish healthcare system guarantees universal coverage and free healthcare access to all Spaniards, regardless of their economic status or their participation in the Social Security network. So basically, all Spaniards have the ability to get healthcare when they need and if they need it. From 1986 to 2002, the healthcare system was centralized nationally in Spain. However, as of 2002, the current management decided to decentralize the system. This decentralization gave the regional health authorities the autonomy to plan, upgrade, and change their infrastructure in order to increase their technological and general developments. Additionally, this plan was implemented to provide greater and more equal access to the population by avoiding the concentration of health services in urban areas. This decentralization also improved response time and increased participation of the target community in the development and management at regional and local health levels. The Spanish healthcare system is divided into 3 organizational levels. The first one is central, second autonomous, and third is local. The central level regards the Ministry of Health, who is responsible for issuing health proposals, planning and implementing government health guidelines, and coordinating activities aimed at reducing the consumption of illegal drugs. The second level, autonomous, involves each of Spain's 17 autonomous regions and is responsible for offering integrated health services for the regional population through centers, services, and establishments of that community. At the third level, the local, which is known as the Áreas de Salud, they are responsible for the management of the health services offered at the level of the autonomous community and are defined by taking into account factors of demography, geography, climate, socioeconomics, employment, epidemiology, and culture. To increase the efficiency, the areas of salud are subdivided into smaller units called the Zonas Básicas de Salud. The Interterritorial Board of National Health System is also known in Spain as the CISNS. This board is responsible for the coordination, cooperation, and liaison among the central and autonomous region health administrations. It's chaired by the National Health Ministry and the members of the regional ministers. It approves a national catalog of services that must be provided by all regional health services. This catalog is divided into services including primary care, specialized care, supplemental care, and pharmacy. Even though Spain has universal coverage and free healthcare for all, there is still private healthcare in Spain. On this slide, I'm kind of going to go through the differences between the primary healthcare and the private healthcare that you see in Spain. So starting off with primary healthcare, there is a healthcare facility that will always be within 15-minute radius from your residency. So anywhere in Spain, within 15 minutes, you can find a healthcare service there that you can attend if you need medical need. The main facilities of the primary healthcare side of Spain's system include general practitioners, pediatricians, nurses, administrators, social workers, midwives, and even physical therapists. However, within primary healthcare, you can find specialized care, and it's provided through specialist outpatient and inpatient care. However, with this specialized care, it's actually interesting because even though you might go to see a specialist for something, if you need follow-up treatment, you will be going to your primary doctor for the follow-up, not the specialist. So that's how it kind of differs in some systems. So in regards to private healthcare, it's not widespread, and many people only use it because there are long waiting lists for these specialists in the primary healthcare system. About 10% of the population have private healthcare insurance. only Catalonia has a nonprofit semi-public entity for private healthcare. And the advantage of private healthcare is that it offers quicker services and a value-added experience and service. So you can get private rooms or express mailing, or you can find information via text or email. So it's a lot quicker and more personal and not as slow as some might say the primary healthcare is. Like most government programs and healthcare systems, Spain funds its healthcare system through the taxations of Spaniards. The health expenditures for Spain account to about 8.5% of the GDP. However, the public healthcare system is about 6.1% of that 8.5%. The financial support for each region is given based off of their demographics and population. So an area like Sevilla might maybe have a little bit more or less resources than, say, an area like Madrid or Barcelona. Additionally, within the primary healthcare system, there is about 2,914 health centers and 10,202 local clinics for basic healthcare. Within the primary healthcare also, there is about 315 hospitals, and the Ministry of Health has about 4 hospitals, whereas on the other hand, the private sector has 464 hospitals in Spain. And lastly, there are about 4.7 physicians per 1,000 inhabitants in Spain. So these are just some statistics regarding the funding and resources that the Spanish healthcare system has. On this slide, I'm going to be discussing some of the challenges that the healthcare system in Spain faces. However, I know that the coronavirus is an ongoing crisis occurring in the world right now and has affected every country in many different ways and has kind of given light to some of the issues some countries face with their healthcare systems. However, I will not be discussing any of the challenges that Spain has faced with their health system and coronavirus. In this slide, I'm just going to be covering the basic challenges that Spain's healthcare system faces in the current world today and that we have seen in years past and that has been prevalent for a while. So starting off on some good news, Spain has actually among the world's healthiest people, and they have a life expectancy where people usually live till about 81 more or less. And heart disease is one of the lowest rates in Spain among the world, which is really good. But on the other hand, skin cancer has one of the highest rates in Spain in the world. Spain actually leaves its rehabilitation, convalescence, and terminal illness responsibilities to relatives. So in the US, we see a lot of nursing homes and retirement facilities where elderly can go to and be taken care of so their families don't need to worry about them. But in Spain, they don't really have as many. They have a lot more fewer facilities like that for the elderly to take care of when they're older. And I think as we touched on before, there's limited coordination between the autonomous communities in Spain, and this kind of stems off the fact that each community has different resources because of their demographics and population. Each community has different needs, and there's disparities between the services and the quality of care. And the government oversees long-term policies, but does not oversee the short-term and day-to-day policies that these regional and autonomous communities deal with every day. So that's why we see a lot of disparities between the different regions. And then the responsibility of healthcare delivery is dependent on the region. So some regions might be better at having healthcare than others, but it's just dependent between each region. So Catalonia might have better healthcare or better delivery than Andalusia, but it's up to each region to determine that. So I think going forward, Spain will hopefully try to fix those problems, but I know in other classes, even discussing like cultural aspects of the different autonomous regions, it's a little bit difficult because every region is so different in their own respects. Thank you for watching. I know I learned a lot about the healthcare system in Spain throughout researching for this presentation, and I'm hoping others have learned more by watching, and I hope everyone is staying safe and healthy out there. So thank you again for watching, and bye-bye.